Good afternoon. My name is Kevin Galvin. I'm here today as a small business owner here in Connecticut for nearly 30 years. I own a small service business in West Hartford and employ a staff of 8. I'm also here today as chair of the advisory committee for the Small Business for Healthcare Reform, an organization of nearly 20,000 small businesses concerned about healthcare. There are many things we can probably agree on today. One is our healthcare system is broken. Another is a broken healthcare system isn't good for our economy. Another probably is we're not fixing it fast enough. And yet another is I think this is a moment in time where we really can create dynamic change in the healthcare system. And I think this session is when it has to happen. As a small businessman, when it comes to healthcare, I can't wait anymore. The problems around the lack of healthcare is one of the first things small business owners bring up when you ask them about the staying power of their business. In my case, in the 4 previous years, I've had the business and the ability to double the size of my staff in my business from 8 to 16. That means I'd be employing 16 state residents, not the 8 great staff I have presently. The single thing that stopped that growth was my inability to attract qualified employees because I don't provide health care. That lack of health care is killing me in other ways. Of my staff, a staff of 8, 4 have never had a family doctor. They've never had a physical in a doctor's office. They've never had a dentist appointment that wasn't an emergency. In one case, I had a staff member out for 11 weeks for a very preventable dental infection. A 28-year-old man with 2 kids, it nearly killed him. These 8 men need to work. I need them to work. Their families need them to work. The state needs them to work. They can't work if they're out sick for preventable medical issues. They can't be in work if they spend days annually in emergency rooms getting help for basic medical needs that could happen in a doctor's office. My story is one of thousands that my members could tell you. In lieu of that, I'm here today for those thousands of owners who say something has to give with regard to health care, and it's got to give now. And we feel it's in the form of getting quality and affordable health care into our toolboxes as business owners. We feel SustiNet is the best plan. I have 1 more minute. SustiNet calls for structural changes. It offers choice. We, as business owners, don't have to take it. Our brokers, that we know and trust, can sell it. Small Business for Healthcare Reform came around this issue of health care because we feel small business did not have a true independent voice in the legislative process. That's until now. We feel the subject of health care is too important for our voice not to be heard. SustiNet is the answer to us. If you want small business in Connecticut to survive and build our economy, help rebuild our economy, we need health care, help with health care. We want the SustiNet product. If you don't find a way to get quality health care available to people with the desire and guts to run a small business, it'll yet be another reason for these people not to invest in Connecticut's economy. I'll be happy to take any questions you may have.
Thank you, Kevin. Any questions? Representative Fontana.
Thank you, Mr. Chairman, and good afternoon, Kevin. A couple questions for you. First, you're a member of a group called the Small Business
for Healthcare Reform.
Very good. Can you tell us a little bit about your group? How many members do you have, or how many employees does your group represent? And can you tell us the sort of span of types of businesses?
It is an organization of small businesses that are throughout Connecticut. They number right now in the area of 19,000. It's growing at leaps and bounds.
19,000 businesses?
Businesses, individual business owners. Okay. It got our attention very quickly as a small group of people got together to talk about health care. How many people were interested in, and how many people were so emotional and so invested in this conversation. And it wasn't hard to build an organization. So we're still in our formative moments.
That's fine. And actually, your final statement leads me to my second question. I believe you just said it wasn't hard to build interest in healthcare reform among small businesses in Connecticut. Is that what you said?
Absolutely not.
Okay. Okay. The second question I have is, we heard testimony earlier in the day from the Secretary of the State, who in her capacity as Secretary of the State meets with small businesses on a number of issues throughout the state, throughout the year, and she testified that there was a problem getting affordable quality health insurance out to small businesses in the state. Then we heard from the Secretary of the Office of Policy Management, who described the small group market as healthy and viable. So I'd just like to sort of get your feedback on those two sort of polar opposites that we heard. One person,
Was he or she at a hearing in Connecticut?
well, unless I was in some other planet or place, it was about 4 hours ago right here.
My apologies for being flip.
No, don't apologize. I'm just saying.
I've been in small business for 30 years. I can tell you that there is only 2 times that I've been on the fringe of going out of business, and one time is when I really made an effort to bring a health care plan on board. It took me almost 4 years to survive that, to move away from it, get my people established on their own, and then go back to doing business. I'll also share with you the fact that I'm a past president of the West Hartford Chamber of Commerce that had, at the time, upwards of 700 members. This was a few years ago, and even a few years ago, the discussion of having health care available at a fair price that was, that would be an actual consumable for a small business was not there then. So in nearly that whole decade, not much has changed. And frankly, I've been at this since 1976, and not much has changed.
So it would be fair to say then that the interest of your members in healthcare reform has come about as a result of a lack of health and viability to the small group market in Connecticut.
There's absolutely no question that that's an accurate statement.
And your experience personally as a small business owner testifies to that as well.
That is true.
Very good. Thank you. Thank you, Madam Chair.
Thank you. Chairman Ritter.
Thank you. Thank you, Kevin, for your testimony. You're a wonderful advocate for your 19,000 members.
Thank you.
I think when we talked last week, you told me it was 18,000.
It's growing.
So
It's been a couple of days.
It's a wonderful growth rate. Other than the inflation rate or the rate of increase in healthcare costs, that's a big number.
It's a good number, except I'm maintaining the website. It's not a good
It's
thing.
not a good number for you. Well, there's joy in success, isn't there?
That is true.
But I want to thank you for advocating for those small businesses. And actually, Representative Fontana took quite a few of my questions away from me because I had asked them myself of the Secretary of OPM, because it was my understanding from the small businesses I talked to, and I represent a district in southeastern Connecticut, that I just don't have anybody coming to me and saying they love their health care and their ability to be able to provide it for their employees. And
I'm shocked.
But I wanted to ask if you, and this is somewhat along the line of what Representative Fontana was asking, are you aware of a differentiation among small businesses? Is it possible that there are sectors in the small business world where this is not a problem?
I understand your question. I don't believe that to be true. I do know that there is a probably equally large number of small businesses that are concerned about what universal health care or a health care plan would cost them. And I think that's a matter of education, because when I look at my absentee rate, look at my lack of productivity, even if costs were to fall on my side, I wouldn't have a problem with that, because my productivity is just getting eaten alive with days off because of these young men and their families being ill, and instead of having a doctor's appointment and going at 3 o'clock with their kid to get fixed up, they're in an ER, shutting an ER down for 6 or 8 hours. So I find this very palatable, but I think with education we can bring many of the small businesses aboard that are not, and I think it's just fear of the unknown, in my opinion.
Well, thank you very much, and I'm going to look forward to continuing to work together on this.
Great.